Good morning, ma'am. I am Mabel Martin, registered nurse for today, and I am here to administer medication through subcutaneous injection. First is gather all materials needed, then check medication order against the physician's order according to agency policy, then clarify any inconsistencies and check the patient's chart for allergies. Then, know the action, special nursing consideration, safe dose ranges, purpose of administration, and the adverse effect of the medication to be administered. Then consider the appropriateness of the medication for this patient. Then perform hand hygiene. Then move medication cart outside the patient's room or prepare for administration on the medication area. Then prepare medication for one patient at a time. Then read the medication administration record and select the appropriate medication from the patient's medication cart or drawer or unit stock. Then compare the label with the MAR. Then check the expiration dates and perform calculation if necessary. And if necessary, withdraw medication from an vial or ampule as described on the previous skills. Then, when all medication for one patient have been prepared, you check the label with the MAR before bringing them to the patient. Then lock the medication cart before leaving it. Then transport the medication to the patient's bedside carefully and keep the medication inside. And ensure that the patient receives the medication at the correct time. Then identify the patient. Usually, the patient should be identified through first is check the name and the identification number on the patient's identification band, or ask the patient to state his or her name. And if the patient cannot identify him or herself, verify patient's identification with a staff member who know the patient for a second source. Then close the door to the room or pull the bedside curtain. Then complete all necessary assessment before administering the medications. Check the allergy bracelet or ask the patient about allergies and explain the purpose of the medication to the patient. Then perform hand hygiene and put on clean gloves. Then select an appropriate administration site. Then position the patient to the appropriate position for the site chosen and drape as needed to expose only the area of the site to be used. Then identify the appropriate landmark for the site chosen. And clean the site with an antimicrobial swab while wiping it in a firm circular motion moving outward from the injection site. And allow the skin to dry. Then remove the needle cap with your non-dominant hand by pulling it straight off. Then grasp or bunch the area surrounding the injection site or spread the skin out at the site. And hold the syringe with your dominant hand between your thumb and forefinger and inject the needle quickly at the 45 to 90 degree angle. After the needle is in place, release the tissue, and if you have a large skin fold, pinch up. Ensure that the needle stays in place as the skin is released, and immediately move your dominant hand to steady the lower end of the plunger. Avoid moving the syringe. And insert the medication slowly at the rate of 10 seconds per millimeter. Then withdraw the needle quickly at the same angle at which it was inserted while supporting the surrounding area with your non-dominant hand. Using a gauze square, apply gentle pressure in the site after the needle is withdrawn. Do not massage the site. Then do not recap the needle. Engage a safety shield or needle guard if present, and dispose the needle and the syringe to the appropriate receptacle. Then assist patient to a position of comfort. Then remove gloves and dispose them properly. Then perform hand hygiene. Then evaluate patient's response for the medication within an appropriate time frame for the medication and document the procedure to the patient's chart.